Hello everybody, my name is Lauren Goodman and today I'm going to be talking about a topic that is very close to my heart. First, to introduce you all to this topic, I'm going to play a video from the National Institute of Mental Health. It's their Mental Health Minute on depression.
Got 60 seconds? Take a mental health minute to learn about depression disorders. They cause symptoms that affect how you feel, how you think, and how you handle daily life. Depression should be treated by health professionals. Don't try to handle it alone or treat it with alcohol or illegal drugs. Treatments include psychotherapy or talk therapy, medication, and sometimes brain stimulation therapy. These treatments may also be used in combination with one another. If you think you might have depression, talk to a trusted friend, family member, or healthcare provider. The earlier treatment begins, the more effective it is. Learn more about depression through the NIMH website and take 60 seconds to share this mental health minute to help someone else.
What is depression like, you may ask? Well, it's like you're drowning, but everyone else around you is breathing. I too have suffered from depression for about 6 months now. My journey has taught me many things about this complex yet very real mental illness that I have set out to share with others. I've gained my knowledge from both personal experiences and from trusted sources such as the National Institute of Mental Health, which is where the video came from. Today, I will focus on what depression is, what the signs and symptoms of it are, how it affects the mind and body, and how it can be treated. First, let me talk about what depression is. According to the American Psychiatric Association, depression, also known as major depressive disorder, is a common and serious medical illness that negatively affects the way you think, the way you feel, and how you act. Feelings of hopelessness, irritability, suicidal thoughts, changes in appetite, and decreased energy are just a few of the signs and symptoms that may occur. To become officially diagnosed, you need to have experienced some of the symptoms or all of the symptoms for a period of 2 weeks for almost every day during that period. Not everyone will show every symptom. Some will show a broad range of symptoms, some will show a few intense symptoms. Every case is different from the next, and that is okay. Depression commonly appears in adulthood, but it can be diagnosed in adolescents and children. Some populations are at a greater risk of developing depression, such as those that have been exposed to negative environmental factors such as abuse or just a bad home life. Those that have a family history of depression, meaning that they are genetically predisposed to it, or those that are overwhelmed by stress easily, which would definitely be me. Now that I've informed you all about what depression is and what its signs and symptoms are, I would like to go over how it affects the mind and the body. Contrary to popular belief, aging is not the only thing that affects your cognitive and physical abilities. Depression can affect your ability to stay on task, make decisions, retrieve memories, and it can impair executive functions, which is what allows us to complete everyday menial tasks such as your chores, getting groceries, taking care of yourself, or taking care of others. Depression either interrupts or reduces neurotransmitters such as serotonin, dopamine, and norepinephrine. Serotonin regulates sleep, appetite, mood, and it inhibits pain. Dopamine influences motivation and affects how a person perceives reality. Norepinephrine raises anxiety by constricting the blood vessels, which raises blood pressure, which raises anxiety. Anxiety and depression tend to go hand in hand, sadly. Depression can occur when systems in the brain that process these neurotransmitters go awry by either becoming oversensitive or insensitive to a particular neurotransmitter. Physical complications that may arise from depression include, but are not limited to, weight gain or loss from either overeating or a lack of appetite thereof, chronic pain, heart disease, insomnia. It can either affect your sleep by making you oversleep or by making you not sleep at all, a decreased libido, which is a decreased sex drive, and it can even cause gastrointestinal issues. Research from 2015 showed that 1 in 5 people with either heart failure or coronary heart disease were at risk from suffering from depression as well. According to Medical News Today, the reason for gastrointestinal issues is that depression changes the brain's response to stress by suppressing activity in the hypothalamus, pituitary glands, and adrenal glands. I now want to address the ways that depression can be treated. Depression is one of the most treatable mental illnesses, thankfully. Cognitive behavioral therapy and pharmacological treatment are 2 highly effective ways to combat it. Cognitive behavioral therapy aims to help patients adopt newer and more positive ways of thinking because depression tends to alter our ways of thinking into more negative scenarios. Through CBT, patients will identify negative patterns of thinking or behavior and then come up with new ways to alter them for the better, thus making their life better. This method has shown to be effective at preventing relapse, according to the Anxiety and Depression Association of America. Pharmacological treatment is carried out using antidepressant medications. Sometimes different medications need to be tried out before finding one that fits best for you, and that is okay. Trial and error is part of life. They often take about 2 to 4 weeks to take full effect, according to the Anxiety and Depression Association of America. Serious side effects may occur, but these generally lessen over time. Today, I have taken the time to inform you all about what depression is, what its signs and symptoms are, how it affects the mind and the body, and how it can be treated. I am very grateful to have been able to share about a mental illness that I care very deeply about advocating for. As someone that is currently fighting the battle of it, I leave you all with the reassurance that you are never alone in this fight. There is a light at the end of the tunnel. I titled my speech, The Invisible Illness. The reason for this is because depression isn't an illness that is visible on one's body. Instead, it is one that is felt in here and in here. It's something that needs to be talked about, and I'm very grateful to have had the opportunity to talk about it today. Thank you.